Good afternoon, colleagues. Our first item of business is First Minister's questions, and before we turn to the questions themselves, can I ask the First Minister if she wants to update the Parliament on COVID-19 and public health?
Thanks, Presiding Officer. I will give a short update on today's statistics. The total number of positive cases reported yesterday was 1,216. That represents 7.6% of all tests reported yesterday. The total number of cases, therefore, now stands at 69,660. 481 of the new cases are in Greater Glasgow and Clyde, 236 are in Lanarkshire, 128 in Lothian, 80 are in Tayside and 80 in Ayrshire and Arran. The remaining cases are spread across the other mainland health board areas. There are 1,252 people in hospital, which is a decrease of 5 from yesterday, and there are 95 people in intensive care. That's an increase of 1 since yesterday. I also regret to report that in the past 24 hours, 39 deaths have been registered of patients who first tested positive in the previous 28 days, and the total number of deaths under that measurement is now 2,966. And once again, I want to convey my deepest condolences to everyone who has lost a loved one. We will also shortly publish the latest estimate of Scotland's R number. We expect that will show that the R number in Scotland is now hovering around 1. That is clearly progress on the last couple of weeks, but of course we require to continue to exercise caution around that. With some other indicators, that does suggest that the tough measures that have been in place in recent weeks and the compliance of the public with those measures is starting to have an effect. But we have to continue to be careful and cautious. We will continue to monitor the latest data closely ahead of the first review of the new level system that will take place next Tuesday. We have seen in other countries, France and Spain, for example, a sharp rise in cases being followed by a flattening of cases, and then that being followed by another rise in cases. So we have to be cautious of that here. As I've been saying this week, it is not enough for us as we head into winter simply to see a levelling off or a slowing down in a rise of cases, and let me be clear, that is what an R number slightly above 1 would deliver. What we want to see going into winter to protect the country, to protect the NHS and to save lives is a reduction in the number of cases, and that will be a factor as we make our decisions in the next few days. Key to all of this, of course, key to giving ourselves the best chance of avoiding further restrictions is for everybody to abide by the rules. That is having an impact, and I would appeal to people to continue to do that. So let me just finish with a reminder of the rules. For people in level 3 areas, they should not travel outside their own local authority area unless essential. People in other parts of Scotland should not travel into level 3 areas, again, unless it is essential. We're asking people also not to travel outside of Scotland right now to other parts of the UK or overseas. None of us should be visiting each other's homes except for purposes such as childcare or looking after a frail or vulnerable person. And when we do meet people from other households, outdoors or in indoor public places, please stick to the limits, no more than 6 people from no more than 2 households. You should work from home if you can, and everybody should remember the rules encapsulated in the facts advice. Wear face coverings, avoid places with crowds of people, clean your hands regularly and surfaces regularly, keep 2 metres distance from people in other households, and self-isolate and get tested if you have any symptoms. Let me thank everybody across Scotland for continuing to abide so closely to all of these rules.
Thank you. Now we're going to turn to First Minister's questions. I would just remind people we'll take the supplementaries after the last question, question 8, but press your button early if you can. And I call question 1, Ruth Davison.
Thank you, Presiding Officer. We have a significant number of cases, we have a shortage of beds, and we have significant staff shortages because of illness and staff isolating. That's the warning that was delivered this week by Professor Jackie Taylor, the President of the Royal College of Physicians and Surgeons of Glasgow, who, alongside the Presidents of the Royal College of Physicians of Edinburgh and the Royal College of Surgeons of Edinburgh, has spoken out about what they describe as an impending winter storm for our NHS. And they've delivered their warning just days after the Scottish Government published its winter preparedness plan. So can I ask the First Minister, how many beds are we short? How many staff are we short because of illness and isolating? And why is it that just a week after that preparedness plan was published, senior medics are already sounding the alarm?
First Minister.
Can I first of all say that we listen very carefully to the Royal Colleges and we liaise very carefully with the Royal Colleges. That will be true of the Health Secretary, the Chief Medical Officer and others within the Scottish Government. We are not short right now of beds or staff, but we do face a very, very challenging winter. That is true of Scotland, it is true of England, Wales, Northern Ireland and indeed much of Europe and the world. And that is exactly why I am asking people to continue to exercise the utmost caution as we try to ensure that cases of COVID do not rise and that the rise does not accelerate, but that we continue to firstly stabilise the situation and then see cases go into decline. That's why we monitor the data so carefully. The positive news, and I say this with all of those warnings about no room at all for complacency, is that in the last week we have seen in terms of hospital admissions and admissions to ICU from COVID be slightly lower than they were in the previous week. So that is one of the indicators that is giving us very tentative and very cautious grounds for optimism at the moment. But there is no room for complacency, and that is why all of us should continue to abide by the rules and ask people across Scotland to abide by the rules. And it is why we will consider very carefully whether we need to take any further steps either next week as we review the allocation of levels or indeed in the weeks after that. And that is driven by our desire to save lives and stop people becoming ill with COVID and to stop the damage that would do to our economy. But it is driven also by that central and driving objective of the need to protect our National Health Service.
Ruth Davison.
If, as the First Minister says, we're not short of beds or staff, why would Professor Taylor directly state it? And it's not just the joint presidents of the Royal Colleges. This week, we've also heard concerns from clinicians at Glasgow's Royal Infirmary. In a joint letter to Health Board Management, they said that the Victorian Hospital was unsuitable for preventing the spread of the virus. Their intervention came following a GRI patient thought to have caught COVID and died after being placed on a ward with patients who had tested positive. The patient's son believes that his dad's death could have been avoided. Given what we know about the spread of COVID in confined spaces such as wards, can the First Minister set out exactly what her government is doing to prevent any mixing of non-COVID patients with those who are known to be infected?
First Minister.
We have a system in our hospitals of red zones and green zones, so patients are streamed depending on their status associated with COVID. We are also working hard to ensure that the capacity of our National Health Service is managed in a way that can cope with whatever COVID throws at us over the winter, and also, as far as possible, continue to treat without cancellation of elective or planned operations the interventions for people who don't have COVID. I'm not sure if Ruth Davison is misunderstanding me here. I am, apart from those who work in our health service, probably the last person who would stand here and say anything other than our health service is under intense pressure. I, the Health Secretary, look closely at bed capacity, at ICU capacity, literally on a daily basis, not just across Scotland, but across all of the health boards of Scotland, as we take the judgments to make sure that we are giving the health service the best possible chance of coping through the winter, and also doing everything we can to save lives from COVID, and we will continue to take these decisions. Over recent weeks, I have faced, and this is not a complaint, this is entirely legitimate as part of the scrutiny process, but I have faced questions about why we have put restrictions on hospitality. I have faced questions about why we've put restrictions on people mixing in each other's houses. I have faced calls to ease up some of those restrictions. And these are difficult decisions that none of us take lightly. But the reason we are being so cautious and so careful right now is to make sure that we do everything we can to protect the capacity of our National Health Service. Today, England is in full lockdown. I can't rule that out for all or part of Scotland, but right now, as of now, we are in a better position. That is down to, in part, the decisions that we've been taking, and much more is down to the compliance of people the length and breadth of the country, but we have no room for complacency at all, which is why when we come to review the allocation of levels on Tuesday, we will continue to take a very cautious and very precautionary stance. And I would ask people across the chamber, when we do that, and if we are being pressed to go further in opening up, remember that perhaps the reason we are not doing so is exactly this kind of exchange that Ruth Davidson is having with me right now.
Ruth Davidson.
But what the First Minister can do is she can look at the regulation which allows for non-COVID patients to be placed on wards with those who are known to have the virus. Now, all parties recognise the importance of testing as a crucial tool in suppressing coronavirus. We've all fought hard to see regular testing of groups such as NHS workers and care home staff. Last week, the Scottish Government rightly reinstated the regular testing of hospital patients over 70 after a whistleblower pointed out that these tests had been quietly dropped. However, there is another group who are often in contact with vulnerable patients and are in and out of care homes regularly, and that is ambulance staff. 3 weeks ago, the First Minister received the same correspondence as I did from a concerned paramedic, highlighting the high risk of spreading the infection and asking for regular testing of Scottish Ambulance Service personnel. I know the First Minister will have responded to the paramedic, as I have, and I ask what action she has taken and whether regular ambulance crew tests have now been initiated.
First Minister.
Can I, first of all, before I come on to the issue of testing and particularly the issue of testing ambulance workers, can I just complete some of the points that Ruth Davidson asked earlier on before we move on. Firstly, it is absolutely the case that we expect hospitals to separate COVID and non-COVID patients along the red and the green zone plan that I've spoken about. We obviously expect and trust those working in our health service to manage demand and capacity in a way that is clinically appropriate. Of course, in terms of capacity, while we are looking very carefully at capacity on a daily basis, we also have, because we made sure we had this contingency earlier in the year, the ability, should it be required, to use the NHS Louisa Jordan for COVID capacity. It's currently helping with non-COVID procedures and consultations on the NHS. Secondly, on the issue of testing over 70s, Ruth Davidson is not being entirely accurate on the position. We never stopped testing of over 70s when they are admitted to hospitals. The change is around testing over 70s on a regular basis, doing it every few days. There was a sense that that was not the most effective thing to do, and that also for older people that can be very invasive. So the regular testing, I think it was every 4 days previously, is now down to clinical judgment and if that is considered appropriate. But the testing of every over 70 when admitted to hospital never changed, and I think it is important to stress that. On ambulance workers, I understand very clearly and very well the desire of people, particularly in our health service, and more generally people who feel they are working in capacities that gives them a higher exposure to COVID, to want to be tested regularly. We are building testing capacity all of the time and rapidly. We are actually doing that faster, and we have more ambitious plans in terms of the NHS Scotland capacity than even we will see build through the UK-wide Lighthouse laboratory network. But we have to take decisions on the use of that capacity based on clinical advice and prioritisation. And the answer to what have we done about that, we just 2 weeks ago or thereabouts, we published our updated testing strategy, which set out the clinical groups that we would expand testing to next. That is based on the advice of our clinical advisors within Scottish Government, and we will continue to consider other groups as it is possible to do that, and ambulance workers and paramedics will be very much part of that consideration.
Ruth Davidson.
Over the coming months, bed capacity will be absolutely critical, but so will the availability of frontline health workers in our hospital. In the first wave of this pandemic, we were able to rely on the superb efforts of nursing and medical students to help the NHS through those difficult months. Nearly 2,500 student nurses and over 500 trainee doctors joined through the COVID accelerated recruitment programme. However, as the Scottish Government's winter preparedness plan also makes clear, ministers believe that it would not be appropriate to mobilise that group of students in the same way this time around because they're not as far through their training. That is entirely understandable, but it does leave a very substantial gap, numbering some 3,000 people who are not going to be available to help in our hospitals during the second wave. We know from the stark intervention from the heads of the Royal Colleges of their grave reservations of how prepared we really are for the pressures of winter. The Winter Preparedness Plan gives no detail of how it will find or recruit extra staff in the absence of student mobilisation. Doctors and nurses are already under pressure and they need reinforcements. So can the First Minister give details of where that recruitment will come from today?
First Minister.
We, of course, continue to have access to the GMC emergency register. We have the pool of returners as well that we are able to draw on. There is a winter workforce plan that is currently being finalised and will be published by the Health Secretary shortly. We are continuing to plan on a contingency basis across all of these different aspects of what is required to ensure the response from the National Health Service that people with COVID and those without COVID have a right to expect. I am, given what I and other ministers are dealing with on a daily basis right now, I am never going to stand here and minimise or underplay the severity of the challenge we face over the winter months. I am extremely concerned about that, and I don't think there will be anybody in my position in any country across Europe who is not similarly concerned, and I don't have any shred of complacency about it. But what I do know is that because of the decisions that we have taken, that this Parliament has collectively been part of in recent weeks, and primarily because of the compliance and the sacrifices of people across the country, we are in a relatively, and I stress that word, we are in a relatively better position as we go into winter than, and I don't mean this as in any pejorative sense, than some other parts of the UK and indeed other countries across Europe. That could change very quickly, and I absolutely recognise that, but we are planning, we are taking careful decisions, we are looking across all of these things every single day. I take my full responsibility for that as we go through the winter, but I would make this point again to people across the country. If we are to get through this winter, keeping COVID under control and therefore protecting the NHS from that winter pressure, there are always other winter pressures that confront our National Health Service, it means each and every one of us has to continue to comply with the restrictions in place. The evidence right now is that that is having a positive impact, and that should give all of us some cautious hope at this stage, but we will only see that progress continue if all of us continue to abide, and that is my appeal, and it is delivered with a lot of gratitude to people across Scotland as we go into this next phase of COVID and indeed go into the winter.
Thank you. Question 2, Richard Leonard.
Thank you, Presiding Officer. We are now firmly in the second wave of COVID-19, and with that comes a second wave of pressure. So let me go back to what Professor Jackie Taylor of the Royal Colleges of Physicians and Surgeons told the BBC this week. She said that the NHS was facing, and I quote her, a perfect storm. She said that the rising number of cases, the lack of hospital beds and significant staff shortages posed huge challenges for frontline staff, especially as we approach winter. But this is a storm that has been brewing for some time. Long waits and limited capacity were already the reality for thousands of patients. Workforce shortages were already having a profound impact on staff and their workloads long before the pandemic. So what action is the First Minister going to take in the National Health Service in response to these stark warnings from the frontline staff in our National Health Service?
First Minister.
We act, I don't need to minimise the challenge at all. I hope people listening to me, not just here just now, but almost every day for the past 7 months would, whatever they think about the decisions I'm taking, would not in any we get the sense that I am underplaying the severity of the challenge we face. I know the severity of the challenge we face, and of course nobody knows that more than those working on the front line of our National Health Service. Going into COVID, our National Health Service faced pressures, but we have the record numbers of staffing in our health service, more staff per head of population than other parts of the UK. That does not take away the pressures. Through COVID, we have worked with health boards to ensure that we have plans in place to deal with the pressures of COVID in terms of acute capacity. For example, that means the ability to repurpose approximately 3,000 acute beds nationally as part of our contingency planning. It includes the ability to firstly double ICU capacity. within 1 week, treble it within 2 weeks, and if required, take ICU capacity to over 700 beds. There are mutual aid arrangements in place between NHS boards to ensure enough capacity to deal with peak levels of demand. And when we have a situation as we do just now, where we have parts of the country with relatively higher prevalence of COVID than other parts of the country, it may well be that those mutual aid arrangements become important. And in addition, as I said earlier on, we have the NHS Louisa Jordan standing ready to help if demand from COVID necessitates that. So these are the plans we have put in place and will continue to ensure are in place, but nobody should be under any doubt, not just here in Scotland, but globally as we go into this winter, we face acute challenges, challenges that may be greater than any of us have ever lived through, because we are living through a global pandemic. And that means governments have a responsibility, and I and the government take that responsibility very, very seriously indeed. But it means every single one of us. What happens with COVID over the winter is not inevitable. It may be inescapable, but it is not inevitable, because each of us have the ability over these next few weeks to try to limit the spread of COVID. And in doing that, we will limit and decrease the pressure on our National Health Service. All of us across this chamber, all of us across the country care deeply about our National Health Service and all who work in our National Health Service. This is a time like never before that in our everyday behaviour, all of us have to put that into practice and behave in a way that will protect that National Health Service.
Richard Leonard.
Thank you. We just simply want the First Minister to listen to the views coming from those staff on the front line of our National Health Service, because the NHS staff have risen to the challenge of this pandemic, and we cannot ignore the toll that the COVID-19 pandemic has had on them. Recent Freedom of Information inquiries by Scottish Labour reveal that in the first wave of COVID, over a third of all NHS staff absences were caused by stress and poor mental health. And COVID is just the tip of the iceberg. Mental health-related absences have been rising every year for the last 3 years. This week is International Stress Awareness Week. So what action is the government taking to ensure that the second wave of the pandemic does not bring a second wave of stress and anxiety for NHS workers?
First Minister.
Well, firstly, I'm going to treat those who work in our NHS and in social care with the respect I think all of us agree they deserve. I'm not going to stand here and pretend to anybody in our NHS or across the country generally that the second wave of a global pandemic will not bring stress and anxiety. It will bring stress and anxiety to all of us, and it will particularly bring that to people working in our National Health Service. I am by no means alone when I say this, and I've said it before. My own sister works in the front line of our National Health Service. I've seen over the past few weeks that pressure build on her in the job she does as more COVID patients have been admitted to the hospital she works in. All of us are aware of that, and I, as First Minister, as well as the sister of somebody in this position, worry deeply about it. And I take my responsibility to do whatever we can to help ensure that that is minimised very, very seriously. And that's why we've taken the steps that I've set out. Of course, we, in addition, have our mental health transition and recovery plan as well, to recognise not just the mental health and stress impacts of those working in health and social care, but more generally. I would say to people across the chamber, across the country, people will agree or disagree with decisions I take. That is perfectly understandable. And people will think and question about whether we're doing enough on X, Y or Z issue. But nobody for a single second should be under any illusion that we do not fully comprehend the severity of what we face, and that we are not literally spending every moment trying to prepare the country for what might lie ahead. But I keep coming back to this point, might lie ahead. The winter will be challenging, I think that is a certainty. How challenging it will be as a result of COVID comes down to all of us, and that is a point all of us must remember and continue to help communicate to people the length and breadth of the country.
Richard Leonard.
Thank you, but we should not accept the inevitability of the heightened stress that staff will face any more than we should accept the inevitability of the spread of the pandemic rising. So, First Minister, NHS workers are demonstrating outside Parliament today for fair pay. They deserve more than the First Minister's gratitude and applause. Last night, Wilma Brown, a Unison NHS representative in Fife, told a meeting that I took part in, and I quote her, that all staff are vital to keep the NHS running, that there has been no let-up, but everything is a fight. NHS workers like Wilma want to prioritise the fight on COVID, but the government is making them fight to prove their own worth. First Minister, this year of all years, your government is only prepared to talk about NHS pay when it is tied to reforms, to cuts to other terms and conditions of employment. That is the Cabinet Secretary for Health's view, that pay and reform go hand in hand. Is that the First Minister's view, or will you deliver fair pay for our NHS workers? No ifs, no buts, no strings.
First Minister.
We are absolutely committed to delivering a fair pay deal for staff in the next financial year. And fairness in this context will mean something different, I think, to what it would mean pre-COVID. So I am absolutely committed to that. But I'm also committed to doing it, which I would have thought a trade unionist would be too, to doing that through negotiation with health service unions. We have a negotiation that is underway. Talks are actively underway with all parties through the Scottish Terms and Conditions Committee. They've been meeting frequently. They most recently met on the 2nd of November. The STAC Secretariat side representatives include Unison, and I think the Health Secretary will be meeting with them shortly to discuss this. We want actually, if we can, to expedite these negotiations and, if possible, to bring forward the agreed pay settlement so that we can perhaps conclude the matter before the start of the financial year. Of course, NHS Scotland staff going into COVID were and remain the best paid anywhere in the United Kingdom, rightly so. But we all recognise, and I particularly recognise, the debt of gratitude we owe to people in NHS and social care, and we intend that that debt of gratitude is repaid, not just in words, but in practice as well. And can I say finally to Richard Leonard, I don't accept the inevitability of any of this, which is why we are taking the toughest possible decisions right now about restrictions we are asking people to comply with. They're not easy, they're not always popular, but they are necessary if we are to ensure that a COVID wave that overwhelms our NHS over the winter is not inevitable. It's why we took really difficult decisions to put limits on hospitality, so that it is not inevitable that we have that second wave. Can I gently remind Richard Leonard that just a couple of weeks ago he stood up at First Minister's questions and accused me of treating hospitality like Sodom and Gomorrah because of taking those tough decisions. You can't have it both ways. You can't ask for us to take the action that makes sure a second wave of COVID is not inevitable and then criticise those actions when we take them.
Question 3, Alison Johnson.
Thank you. Our NHS workers deserve a pay rise, but they also all deserve the protection of testing. We've heard about Professor Jackie Taylor's concerns about staff shortages and a lack of beds, but she has also called for a coherent strategy for testing staff and hospital patients. The Scottish Greens wrote to the Scottish Government on the 25th of April calling for weekly testing for those working in our care homes and hospitals. Care home testing was announced for staff on the 25th of May. Well, it's now the 5th of November and someone could still be working in a Scottish hospital with COVID and not even know it. The Nosocomial Review Group have approved a new strategy for regular hospital testing, and the Scottish Government's own testing review established weekly testing as a priority for Scotland. So can the First Minister give us a date? When will routine weekly testing for all hospital staff begin?
First Minister.
We already test groups of hospital and healthcare staff, so all Asymptomatic healthcare staff are already tested for COVID where there is an outbreak in a previously COVID-free ward. Previously in the summer, that was extended to include staff working in the highest risk areas, specialist oncology wards, long-term care of the elderly wards and long-term care, long-term psychiatry wards. Healthcare workers are already also offered testing if they are working on non-COVID wards where there is a cluster, and local infection prevention and control teams are also advised to consider testing staff when a single unexpected case of COVID is identified in a ward. And we continue to move forward with the recommendations and the priorities set out in our testing strategy, which will extend routine testing in the NHS as it will do across social care. We have to do that in line with building up the capacity to do that. As we've set out before, the top priority for our testing capacity right now is people with symptoms, because that is how we best break chains of transmission. Beyond that, the priority we have set, and this has been happening for some time now, is weekly testing of staff working in care homes, given the vulnerability of care homes. I've already talked about the groups of NHS staff that are already tested, and as we build the capacity between now and the end of the year, that will progressively build up to include more groups of staff in the health service, and we will continue to keep Parliament updated on that progress.
Alison Johnson.
The City of Liverpool is seeking to test all who live there. Slovakia is testing its entire population, but we are still not committed to testing everyone who works in our hospitals, where there are many vulnerable people. I understand that the Chancellor of the Exchequer has just announced that the furlough scheme is to be extended until March. Now, it's absolutely vital that he confirms that no worker will be forced to live below the minimum wage. Greens, unions and others have been calling for this for months, and it is welcome, but for many it comes too late. The UK government's hard deadline on Saturday meant that thousands of people lost their jobs before the PM's last-minute U-turn. So can I ask what engagement the Scottish Government is having with businesses to enable and support them to rehire and furlough staff who have been let go at this very challenging time?
First Minister.
I'll come on to furlough in a second. Can I just finish off on testing, though? Alison Johnson asks very legitimate questions and takes this issue very seriously, as she should do, and that's important. But it's really important that we all understand things that are said in this chamber. Take the reference to Slovakia. Slovakia is doing antibody testing of its population. Now, we don't yet know what antibody testing tells people. So Slovakia is not population testing on a diagnostic basis. And I think it's important to understand these distinctions. The Chief Medical Officer actually set that out to Alison Johnson's colleague in the COVID committee yesterday. Liverpool, we are looking closely at Liverpool. We're involved UK-wide in discussions about pilots, but we don't yet know exactly how that Liverpool pilot will go. We are also looking ourselves at how we've been doing testing of rapid point-of-care testing over the last few weeks, which we're waiting on the clinical validation of. So we are enthusiastic about taking the developments in technology as far as we can, but we're focusing also on the here and now of making sure that our current testing system works effectively and efficiently, and we'll continue to do that. On furlough, I haven't had the opportunity to see the detail of the Chancellor's announcement. I hope it's an announcement that we'll be able to unreservedly welcome, and certainly if it is about extension of furlough on 80% terms, then we will do so. The acid test on this will be whether somebody, whether in Scotland, England, Wales or Northern Ireland, who is on 80% furlough now, just because England is in a full national lockdown, will continue to be on 80% furlough once England is out of a full national lockdown. That will be the acid test and the detail that I am looking for. Unfortunately, because many businesses and workers expected the the existing furlough scheme to end at the end of October, and I know people in this circumstance, we'll all know people in this circumstance, made people redundant. I know people who put businesses into liquidation because they didn't think furlough was going to be extended, and I think that is deeply regrettable. We should have had the ongoing assurance of 80% furlough from the Chancellor all along. We will work with trade unions, workers, businesses, to try to help as much as we can everybody who is eligible for furlough on the terms that I hope now is being extended on, to access that as effectively as they possibly can.
Question for Willie Rennie.
I want to return to the issue of testing, because I think the First Minister has been behind the curve on much of testing, but it's not too late to catch up. What I want to understand is why all the innovations are happening in other parts of the country and other parts of Europe. 8 months into this crisis, we should have the capacity to do more than this. If Slovakia are looking at that testing, and they've tried it over the weekend, if Liverpool are going to test 500,000 people, why are we not looking at that innovation here in Scotland too? We could start with Lanarkshire or Students for Christmas, which I know the First Minister is looking at, but for all we seem to do is keep all options under review. We need to be doing more than this. So can the First Minister give us some kind of timetable for when this kind of innovation is going to happen?
First Minister.
Willie Rennie is just wrong about that in many different respects. So, for example, we have over recent weeks been testing a technology called Lamira testing. We have been doing the clinical validation. We're waiting on the outcome of that so that we can get that in use broadly across our NHS. You can't just start using new technology without going through the proper validation. If I am right, as I understand I am, although I'm clearly not an expert on the Slovakian approach to COVID, but if it is the case, it's antibody testing. Frankly, the judgment of my clinical advisors right now is that doing population-wide antibody testing is not effective, because nobody can yet tell a person what, if they test positive for antibodies, what that means. Does it mean that they are immune for a day, a week, a month, a year, or not at all? So that is not something that our consideration would say is a sensible thing to do right now. We are cooperating with other UK countries on other technological developments, and actually Scotland has a good reputation of not being behind the curve on rolling out new technology, but actually being ahead of the curve. You know, maybe I'm being cynical here, but sometimes we hear about things like the Liverpool pilot, which I'm not knocking. I think we will be looking with interest at that. But we often hear about these things when the testing system more generally is coming under a lot of pressure in England. Let's focus, as we are doing, on building our testing capacity, which we have done dramatically and will do even more by the end of this year, and then using that capacity in the best possible way to limit the spread of COVID. And with all the caveats about not a shred of complacency, I recognise readily, Presiding Officer, that I could be standing here, inadvertently promoted the Presiding Officer, or demoted, whatever way you want to look at it. But I could be standing here next week in a completely different position. But right now, Scotland is in a relatively strong position because of the decisions we're taking and the compliance of the public. And as part of that will be the way we are using testing tactically. So let's keep focusing on the things we need to do to maintain that strong position and stop the COVID position deteriorating. That's what I spend every waking moment doing. It's what the Health Secretary and my colleagues spend every waking moment doing, and that will continue right throughout the winter.
Willie Rennie.
And we all think about that too. We all think about how we can get on top of this virus. This is not the exclusive preserve of front bench ministers. The First Minister will understand my concerns and my frustrations on all of this. She's only recently been persuaded about the merits of the widespread use of asymptomatic testing. Only just recently did she be convinced about that. So the scale of this is insufficient. We need to move much faster than we have done so far. Now, last week, 854 children and young people tested positive, and 404 people employed in education and childcare the week before that. Schools are now taking extra precautions with senior pupils wearing face coverings. And there's new ventilation and CO2 monitors. But teachers who were shielding earlier this year are still being told they can't work from home. So why is the government taking such a risk with this vulnerable group of people?
Before I come on to shielding, let me just finish off on Willie Rennie's testing point. Another example of us looking at new and developing technology, we're establishing regional testing hubs right now, which will be operational before the end of the year. One of the things they are trialling is the pooling of testing so that you can do more than you can at the moment. So we are not behind the curve on new technology, we're actually pushing ahead with this. With the greatest respect to Willie Rennie, I listen carefully to what he says. I hope he genuinely believes that, because I mean it. But when it comes to decisions about who to test for a virus or not, then I have to listen more to my clinical advisors about the efficacy with asymptomatic testing versus prioritising symptomatic testing. Views on that have changed as the knowledge and evidence around the virus have changed, but I will continue to be driven and guided by the advice that people with expert knowledge have about these things, and we will continue to push ahead with that. In terms of the points about schools generally, I think it is important that we keep schools open if we possibly can, and if that means putting in place more mitigations like the use of face coverings in senior pupils, then I think that is important. So I think we recognise across the chamber in the balance of harms consideration, having young people not at school full time does a lot of harm to them. So we must avoid that as far as possible. In terms of shielding, I want to be very clear to employers, whether that is a local authority employer or a private sector or other public sector employer, is that they must exercise extreme caution with those in the shielding category and facilitate working from home if that is for the safety of the person who is in the shielding category. I can't take all of these individual decisions between employers and workers, but I'm very clear that the safety of people who have been in the shielding category is absolutely paramount.
Thank you. Question 5, James Dornan, who joins us remotely. James Dornan.
To ask the First Minister, what additional support has the Scottish Government made available for mental health services to help cope with the long-term effects that lockdown and ongoing restrictions have had on people's mental health well-being?
First Minister.
Well, as a government, we strive to find the best possible balance between our responsibility to protect lives and, of course, mitigating the other harmful impacts of the measures needed, and that includes impact on mental health. Our Mental Health Transition and Recovery Plan outlines our response to the mental health impacts of COVID and includes the actions we're currently taking forward. On Monday, the Health Secretary announced funding of £50 million to respond to children and young people's mental health issues. We've also significantly invested in additional support, including more than £1 billion for NHS boards and integration authorities to meet the costs of responding to the pandemic. Funding for additional mental health costs is included within that, and we expect it to be used to meet these pressures. Additionally, we've provided dedicated funding to provide additional telephone and online support services. Some of this funding was to expand the work of the NHS 24 Mental Health Hub and the Breathing Space Helpline.
Dornan.
Thank you very much, First Minister. But could you tell me if there's any specific actions being taken to balance the dangers to the mental health of elderly people of a lack of interaction with others, primarily at home, but of course also in care homes or hospital settings, against the ever-present dangers of COVID?
First Minister.
It is a really important question and one that is always at the forefront of our minds. Restriction around care homes have been amongst the most difficult decisions that have had to be taken through the pandemic. That's why the latest care homes visiting guidance recognises the importance of ensuring that older people are able to maintain connections as safely as possible, and it looks to ease where it is safe to do so restrictions on visiting. Guidance has also been produced to assist care homes with strategies for promoting the well-being of residents and to provide advice on therapeutic interventions to help manage increased stress and distress for residents resulting from any COVID restrictions.
Question number 5, Jamie Green.
Thank you. To ask the First Minister what advice has been offered to local authorities regarding which measurements would trigger a move through the new tiered system of COVID-19 restrictions.
First Minister.
The new strategic framework and supporting assessments set out the criteria used to determine the allocation of levels, including the indicators that are used to inform these decisions. The framework also makes clear our commitment to engage with local authority partners prior to making decisions. We recognise their support is vital to the success of this approach, and of course we rely on them to implement and oversee the measures. We engage with local authorities through both COSLA and SOLACE in advance of the publication of the framework, and local authorities were consulted prior to the setting of the current levels, and they'll continue to be involved both through their representation on the National Incident incident management team and directly in advance of future allocation of levels.
Jamie Green.
Can I thank the First Minister for that response? The First Minister will be aware that Inverclyde has been placed into Tier 3, despite meeting many of those indicators that would imply otherwise. A group of 16 local businesses, alongside their local MSP, have written to the First Minister, asking simply to be treated fairly in comparison with other parts of Scotland. Up to 1,000 local jobs are at stake, and that's a lot of jobs in an area which is struggling economically. They, as everyone does, accept that the need to protect the NHS is at the forefront of decision-making, and I know they want to do the right thing, but they are right to ask if or how they can move tier when the final determination is based on factors outside of their control and as a result of which health board they happen to be in. So can I ask what hope there is for areas like Inverclyde, that there is a clear roadmap with clear milestones that they can all work towards to offer them some hope? And would the First Minister be willing to meet these local businesses and hear their plight?
First Minister.
We talk to the business community, and we are always happy, either myself or the Economy Secretary, to engage with businesses at local level. The indicators, and I set this out last week, and I think we will all get more used to both the application of levels and the decisions that drive those. The indicators guide that process. This is not a simple algorithm of feeding certain data into a computer and getting the answer out. We have to apply judgment. And unfortunately, wherever you live in Scotland, you are reliant on certain hospitals, and therefore the issue of Inverclyde and its place within the Greater Glasgow and Clyde health framework is not incidental, because pressure on Glasgow hospitals would mean that if we eased up in Inverclyde to the point where even there was a slight increase in demand for those services, then that could be difficult for people in Inverclyde as well as the whole network. So these decisions are carefully balanced. We also have to look not just at where a particular local authority is in the indicators, but also what their direction of travel is and how sustainable we feel their position is. And over the last couple of days, and obviously we will be looking at this very carefully, we've actually been seeing an increase in cases in Inverclyde, which would perhaps suggest that the decision not to put them down to a lower level was the right one. What we've got to remember here, two things briefly, Presiding Officer. Firstly, and this is a point I've been trying to set out this week, it's not enough to have an allocation of levels that just holds things steady. Because if we go into the winter period with a level of infection such as we have now, even if it's quite a steady level of infection, it's too high and it would carry enormous risks. So we have to have an allocation of levels that gets infection coming down, and that is really important. And we have to also recognise, and this is my second point, is that taking an area down a level is not a neutral act. Like obviously all areas want that, but going down a level means an opening up of things that are currently not open, and that will increase the transmission of the virus. So it is a really important judgment before you do that, to be as certain as you can ever be in these situations that that increase in transmission that you will inevitably cause can be coped with. And that is why the sustainability of the position is important as well. These are really finely balanced judgments. And going back to my exchanges with Ruth Davidson and Richard Leonard, let's not forget here that the reason we need to be extra cautious is about saving lives, it's about protecting people from COVID, but it is also about making sure that we do not allow our NHS to be overwhelmed. And I would ask people, when asking these questions on behalf of businesses, which I totally understand, to bear in mind the exchanges I had with the leaders of the opposition parties earlier on.
Question 7, Polly McNeill.
To ask the First Minister what action the Scottish Government will take to prevent a dental health crisis for people living in poverty in the coming months and years.
First Minister.
Good oral health is essential for people's general health and well-being, and we're absolutely committed to making sure that that is a priority as we go through the pandemic. We're working to resume the wide range of improvement programmes for children and adults in key priority groups. That includes the Oral Health Community Challenge Fund, Child Smile, Caring for Smiles and Smile for Life. Toothbrushing in nursery and school settings should resume as soon as establishments are able to, with the aim to fully implement that by January. And from the 1st of November, we have seen patients now able to access the full range of NHS care and treatment from dental services, and will continue to support the dental profession as they go through the challenges of this situation.
Pauline McNeill.
I would like to acknowledge the progress that had been made in dental health care before the pandemic, but some dentists have raised concern that we're heading for a two-tier dental system. For those who can afford it, can access private dental care, but those who can't, waiting on long queues for NHS treatment, I believe because there are differences in the restrictive practices. The Chief Dental Officer said recently, "I don't think patients should be told to go private. I think that would be an invidious position." But First Minister, this is exactly what is happening across Scotland, and it's been happening for months, where people are being told to seek quicker treatment by going to private practice. This will affect adults and children in the most deprived areas. In fact, it will probably affect quite a large part of the population in Scotland if it's not addressed. As we know, the children are more likely in deprived areas to have higher levels of tooth decay. So I ask the First Minister if she will consider an urgent dental plan going forward to prevent the two-tier system developing, but also to assess what government support NHS dentists might need, as many have struggled to survive through the pandemic.
First Minister.
Yes, we will continue to consider all of these issues, and the Chief Dental Officer will certainly be doing that. We've increased the range of dental treatments available within the NHS with each phase of remobilisation. We've made that possible by the provision of appropriate PPE to NHS dental contractors at no financial cost to them. We've also been working to understand in greater detail the risk of transmission in dental settings. But I would make a key point here that from the 1st of this month, so just a few days ago, we have had a position where NHS dental services are able to provide a full range of treatment options to all NHS patients within NHS dental practices. We know there will be a backlog of cases which will have an effect on waiting times, and we have to continue to work to address that. But we will do that. We will do that with dentists, and we will do that as effectively as we possibly can.
Thank you. Question 8, Rachel Hamilton.
To ask the First Minister what guidance the Scottish Government has issued for marking Remembrance Sunday.
First Minister.
Well, we've sought to work closely with local authorities and third sector partners to ensure that they have the most up-to-date COVID guidance and help them understand any impact this has on remembrance events. Updated advice was issued to all local authorities last week, advising that no outdoor events or gatherings are permitted in areas placed in levels 2, 3 or 4 under the strategic framework. Services at places of worship can proceed at all levels, although of course there are restrictions on numbers of attendees. These decisions are not easy, but of course we must prioritise suppressing the virus to save lives. We would of course encourage everyone who wants to pay their respects to do so safely in other ways, and I take the opportunity to encourage people, if they can, across the country to join the 2-minute silence on Sunday at 11 AM from their own doorsteps, as we collectively as a nation convey our respect and appreciation. I will lay a wreath on Sunday on behalf of the nation at the Scottish National War Memorial at Edinburgh Castle, and I'll be deeply privileged to do so.
Rachel Hamilton.
I thank the First Minister for that answer. Presiding Officer, members across the Chamber will share my disappointment that commemorations this year are being scaled back, but understandably to prevent the spread of coronavirus. Despite the pandemic, we must commemorate the valour of our veterans and remember those, including family and friends, who paid the ultimate sacrifice to fight the freedom for our country and indeed across the world. The First Minister has quite rightly pointed out that we should encourage Scots to mark Remembrance Sunday at home with a doorstep 2-minute silence, or by downloading and displaying a poppy in the window. And in the absence of traditional fundraising opportunities, will she encourage everyone to support the online Scottish Poppy Appeal, which raises vital, life-changing funds for our armed forces community in Scotland?
First Minister.
I would strongly encourage people to support the Scottish Poppy Appeal in any and every way they can. I would encourage that every year, but I would particularly encourage it given the difficult circumstances we face this year. The Scottish Poppy Appeal does excellent work and work that is so valuable to so many people. And let me take the opportunity to put on record again my deep appreciation to them. I would, as I already have done, encourage people to show their respect for those who have paid the ultimate sacrifice, for all those who have served in our armed forces, and to all those who continue to serve in our armed forces through a doorstep respect for the 2-minute silence on Sunday, or in the many other ways that that can be done safely. Many things have hurt people deeply over the pandemic, things that we all value highly that we have not been able to do. But I know people, many people across the country, will feel particularly acutely the inability to mark Remembrance Sunday in the way that is traditionally done. But that does not mean we don't mark it. That does not mean we don't show our respect. There are ways in which we can do that, and I'm sure the whole country will join together to do exactly that.
Thank you. We move on to supplementaries. Maureen Watt to be followed by Donald Cameron. Maureen Watt.
Thank you, Presiding Officer. To ask the First Minister what discussions the Scottish Government has had with the oil and gas industry regarding the provision of COVID testing for workers prior to travelling to oilfield installations and when returning back on shore.
First Minister.
Testing is currently available at onshore testing facilities under the UK-wide testing programme for workers in the oil and gas sector and family members who display symptoms. That is the same provision as is available for other key workers. The current test for COVID is highly effective at detecting the virus in individuals with symptoms, but less effective, not completely ineffective, but less effective for asymptomatic individuals. There are obviously other areas where we carry out more routine asymptomatic testing where the evidence tells us to do so. In addition, I know that the Chief Medical Officer met with Oil and Gas UK in August to understand directly the sector's asked for asymptomatic testing and how this could support them through the oncoming winter period, and we will continue to engage with them.
Donald Cameron to be followed by Monica Lennon. Donald Cameron.
In light of last night's vote by Parliament to set up an immediate public inquiry into the tragedy of deaths in our care homes during the pandemic, can the First Minister outline what steps the Scottish Government is now taking to set up such an inquiry in order to respect the will of Parliament?
First Minister.
We've long been clear that we would be instigating a public inquiry into all aspects of the response to an impact of COVID, and that includes care homes. Of course, we take note of the views of Parliament, and because of that, this morning the Health Secretary has written to counterparts in the Northern Irish, Welsh and UK governments to seek early discussions on whether and how such an inquiry could be established on a Four Nations basis. And the Health Secretary will also be inviting opposition spokespeople for discussions next week to discuss the next steps in establishing any inquiry. So we intend to take that forward. As all members of the Chamber know, to establish a statutory public inquiry takes certain steps and cannot simply be done overnight, but our commitment to doing that and to doing that as quickly as possible, while ensuring, of course, that those on the front line in any capacity can continue to focus on getting the country through the second wave of COVID. Our commitment to doing that is absolute.
Monica Lennon to be followed by Gillian Martin.
Thank you, Presiding Officer. Can I add my solidarity to Unison NHS Lothian members who are demonstrating outside Parliament today on behalf of their colleagues from right across Scotland? Their message is clear: clapping is cheap, broken promises are an insult. So when will the Government deliver fair pay for our healthcare workers? And speaking of heroes, I want to pay tribute to University Hospital Hairmire staff for their brave response to a very serious fire in a COVID ward last week. The First Minister will know from her daily review of bed capacity that Hairmires and other Lanarkshire hospitals are at breaking point, and staff and patients are very anxious. So can I ask the First Minister for an update on the current situation in Lanarkshire in terms of bed availability and what is the forecast for the week ahead?
First Minister.
I'll ask the Health Secretary to provide the detailed information on NHS Lanarkshire, which I don't have in front of me, but we look at all of these things regularly. The capacity of the health service is under pressure, and nobody should be in any doubt about that. That is why we are taking the decisions we're taking to try to suppress COVID. And I would ask everybody who is asking these questions very legitimately about pressure on our health service, to remember that when we are also scrutinising and making decisions about the necessary, albeit unwelcome, restrictions that require to be in place. Can I just also take the opportunity to thank staff at Hairmyres? What happened last week, investigations into the cause of the fire are ongoing, but that was a very frightening incident for those who were involved. But what I do know from the reports I have been given is that staff acted above and beyond the call of duty and in the interest of patient safety, and they have my grateful thanks for that. On pay, we are determined to ensure a fair pay increase for NHS staff next year. I've set out the process that is underway, and that process is important. If I was to stand here right now and say what a pay agreement was to be without proper negotiation with trade unions, I am pretty sure that Labour members in particular would criticise me for imposing a pay deal without proper negotiation. So we will negotiate in the proper way, in good faith, because that is the right thing to do, and we will deliver fairness for NHS staff because, as everybody agrees, they deserve it.
Gillian Martin, to be followed by Liam Kerr. Gillian Martin.
Thank you. I've been contacted by students from North East Scotland College undertaking an HNC in care and administrative practice, which is part of a programme with Robert Gordon University working towards a nursing degree. A large component of their overall grade is gained from a practical placement. These college students have not been given the same COVID-19 insurance as university students, meaning they might not be able to take up their placements. And according to Colleges Scotland, this is affecting 1,200 students across Scotland. Can the First Minister urgently look into this situation and ensure these students have the necessary insurance, which has already been given to university nursing courses?
First Minister.
Yes, I am aware of this. It has been drawn to my attention, and the Chief Nursing Officer is urgently looking into that. We want to resolve this situation in a satisfactory way as quickly as possible, and I will ensure that I or the Health Secretary write to Gillian Martin when we've reached a conclusion of that.
To be followed by Colin Smith. Liam Kerr.
Thank you, Presiding Officer. Recently, various newspapers reported on a COSLA document which contained proposals from Community Justice Scotland to slash community sentence hours, apply a legislative cap on the prison population and increase use of suspended sentences and sentence discounts. Will the First Minister rule out every one of these proposals?
First Minister.
I always think it is better not to rule out things on criminal justice when invited to do so by the Conservatives, not because they don't often raise very serious and legitimate issues, but because I do think it is important that we have an approach to criminal justice that is focused, yes, on appropriate punishment, but also on prevention and early intervention. And community sentences are an important part of that. Reducing short-term prison sentences are an important part of that, and making sure we have a justice system that is focused on reducing reoffending in the most effective way is, I think, the important thing to do. So we will continue to take forward proposals that we think contribute to that.
Colin Smith, to be followed by Alistair Allen. Colin Smith.
Thank you, Presiding Officer. First Minister, across Scotland, our taxi drivers are facing financial ruin with business decimated by COVID restrictions. For many, their cab is their office, so they weren't eligible for the Coronavirus Restrictions Fund, which only pays out if you're registered for non-domestic rates. Yet they are viable businesses if they can get through the next few months. We've seen support for rail firms, for ferry firms and for bus companies. So can I ask the First Minister to urgently consider specific support for our forgotten taxi drivers before more of them are forced to join the ranks of Scotland's rising unemployed? Our taxi drivers were there when we needed them at the height of lockdown. They now need their government to be there for them now.
First Minister.
We have sought to provide as much support to as many groups as possible. I recognise the point about domestic rates and the difficulties that causes for some groups of workers and businesses. So we will continue to look at what more we can do. I will make the obvious point that our resources are finite and we cannot continue to stretch them. That's why our discussions with the UK Government are also a really important part of this. But I recognise the difficulties taxi drivers face, and we will continue to look at what we can do to help them and other groups who are finding this situation so difficult.
Alistair Allen, to be followed by Mike Rumbles.
Presiding Officer, I understand that the Chancellor has just made an announcement elsewhere about furlough. A week of chaos and confusion from the Tories. They U-turned on abolishing furlough, only apparently to U-turn on whether it would apply to Scotland after the 2nd of December, then to U-turn again when the Treasury said no, and finally, perhaps today, they will have completed yet another U-turn and belatedly conceded that Scotland must have fair access to this scheme. Doesn't all this show, presiding officer, on bonfire night, that Tory credibility on the Scottish economy has gone up in smoke? First Minister.
It's perhaps hard to disagree with that, but I'm going to try and avoid the temptation. As I said earlier on, and Alistair Allen's right to raise this issue, but I've not yet seen the detail of the Chancellor's announcement because I've obviously been in the Chamber. I look forward to seeing that detail as soon as I can. I hope it is everything that we are expecting. As I said, the acid test will be if somebody who is able to get 80% furlough right now while England is in lockdown, will they still get it after the 2nd of December? If the answer to that question is yes, I will certainly warmly welcome that. Beyond that, I do think there is a real question here, and all of us, I've said this all along, and it is applied to the Scottish Government at times when we've got things wrong, and we have to reflect on that and we have to try to learn the lessons. And I definitely think on furlough, that is the situation that the UK Government is in. There will have been jobs lost last week and in the last couple of weeks because of the failure to guarantee earlier what has now apparently been guaranteed. And I think the UK Government should take a long, hard look at that and make sure they do not allow themselves, and more importantly, allow businesses and workers to be in that position again.
Mike Rumbles to be followed by Stuart McMillan.
Does the First Minister understand that threatening to impose an unenforceable legal ban on travelling outside your council area with all the problems that will result from that, risks undermining policing by consent, but also risks undermining much needed public support for the very measures that we should all be supporting?
Minister.
I'm interested in Mike Rumble's views, and I don't know whether or not they reflect the views of his party, but there was a vote in the House of Commons last night on regulations that don't just stop people moving between different parts of England, they stop people leaving their house. And I'm just interested in that because all 4 Scottish Liberal Democrat MPs voted for that English measure in the House of Commons last night. Now, these are serious issues, and I recognise there's a difference of opinion, and actually I think it's really good to air these things. England's in lockdown today. I can't guarantee that we will not, in terms of all our part of Scotland, follow suit at some point. But right now, we're not there. We're in a better position. Partly because we acted earlier with some restrictions and largely because people have complied with those restrictions. But we have to be under no illusions about what it is we are required to do if we are to stay in that better position and hopefully avoid the country going into a similar lockdown to England. Firstly, we have to encourage people to continue to comply. And secondly, and this is hard for everybody, we absolutely must stop the virus spreading from high prevalence areas of the country to low prevalence areas of the country. You cannot have a targeted, proportionate regional approach to COVID restrictions unless you have travel restrictions as part of it. I don't like that. I'm sure not many people across the country like that, but that is the reality of the situation we're living in right now. There are trade-offs in this. If we want to have the greater normality that not being in lockdown gives us, then we must accept the other restrictions that make that possible. And those are the decisions the Scottish Government will continue to take. We'll set them out clearly to people, and even if they're not popular, if they're about keeping the country safe and protecting as much normality as possible, we will not shy away from taking them.
Stuart McMillan to be followed by Margaret Mitchell. Stuart McMillan.
Thanks, President Officer. Can the First Minister clarify the rationale why children under 12 are included in the total number of permitted attendees to a wedding, when in all other settings children under 12 are not included in the total?
First Minister.
Weddings are an exception to the general rule on gatherings, which reflects their importance in people's lives. So the number of people who can attend a wedding is higher than the number of people who are generally allowed to meet in one place, and regrettably at the moment that means that the judgment is that children should be included in the limits at the different protection levels. Otherwise, children from up to 20 households could attend a wedding, and the numbers and the risk of transmission that would result in would be significantly greater. Under the current rules on meeting others inside, children under 12 are excluded from the numbers, but they must belong to one of the households meeting, which reflects the additional risks that arise when mixing inside. The current position takes account of public health advice and is there for the purpose of keeping people safe. I recognise it's one of the most difficult things about this is that it is possible to look at these rules and see inconsistencies, but we have to try to limit the risks of transmission overall, and that is sometimes just about the volume of people meeting together as well as the particular settings they're meeting in. So I would ask people to question these, because it helps us make sure we're getting it as right as possible, but to understand that sometimes these apparent inconsistencies are just the trade-offs that we require to make to have some more freedom, but to do that without increasing to a dangerous level the risks of transmission.
Margaret Mitchell.
Thank you, Presiding Officer. Last night, the Scottish Government expressed its will that the Scottish Parliament expressed its will that the Scottish Government release all legal advice in relation to the judicial review of its handling of complaints against Alex Salmond. Will the First Minister please confirm that the Government will comply with this instruction, and further confirm on what date the legal advice will be published?
First Minister.
Well, the Deputy First Minister made clear, I think in a point of order, I wasn't in the chamber last night, that we will now consider the implications of the motion that Parliament passed. But if I was to do what Margaret Mitchell has just asked me to do there, I would be blatantly breaching the ministerial code, and perhaps that's what Margaret Mitchell wants me to do. But let me point out why. Paragraph 2.38 of the ministerial code firstly says ministers must not divulge contents of legal advice. Then at paragraph 2.40, it does recognise that in exceptional circumstances, ministers may decide that the balance of public interest favours disclosure. But if so, ministers must, and I repeat, must obtain the prior consent of law officers, and that consent will only be given if there are compelling reasons. So ministers do have to consider now the vote last night. The Deputy First Minister made clear ministers will do so. I have rightly, I think, recused myself from that decision, and as John Swinney said to Parliament last night, he will advise Parliament accordingly in due course of our response.
Thank you very much, and I've let the session run on for an extra 10 minutes, but I'm afraid we have to conclude there. We're going to suspend and resume at 2:30. Parliament is suspended.